Normal red blood cells have a lifespan of around 4 months, and when they need to be broken down, that is going to be mainly done by the spleen as well as the bone marrow. Now, when red blood cells are broken down, they're going to be broken down into heme as well as the protein globin. Globin is going to be ultimately broken down into amino acids, and then these amino acids can then be recycled. And heme is going to be acted by macrophages, and it is ultimately going to be broken down into iron as well as unconjugated bilirubin. Now, the unconjugated bilirubin is lipid soluble, meaning that it needs something to transport it in the blood. And that something is going to be albumin. So albumin is going to transport unconjugated bilirubin in the blood to the liver. And we see that in step number 2. Now, in order to make it water soluble, the unconjugated bilirubin is going to go through a reaction. And we see that in step number 3. Glucuronic acid is going to be added to the unconjugated bilirubin to make it water soluble, and now it is going to be called conjugated bilirubin. And we see that over here. Now, conjugated bilirubin can then go back into the bloodstream and then come to the appropriate region of hepatocytes to be released into the small intestine through the common bile duct. So the conjugated bilirubin is going to be released by the common bile duct into the small intestine. Now, in this small intestine, it is going to be acted on by bacteria, and the bacteria is going to take off that glucuronic acid, and now that conjugated bilirubin is going to be called urobilinogen. Urobilinogen is lipid soluble, and now it is going to need albumin if it wants to go back into circulation, because it needs albumin for it to be transported in the blood. 80% of urobilinogen is going to become stercobilinogen, which is basically a precursor for stercobilin. And stercobilin has a brown pigment, and ultimately it is going to be excreted by our rectum as feces. Now, 20% of urobilinogen is going to go back into the circulation, and around half of it is going to be, so 20% is going to go back into the circulation, and then half of it is going to go back into the liver, where it can be excreted within bile again to the small intestine. And the other half is going to go to our kidneys, and in our kidneys it is going to be converted into urobilin, and urobilin, it has the yellow pigment, and we're going to get rid of it through urine, and that is why our urine has the characteristic yellow color.